So thank you very much again. What I'm trying to do in the next 15-20 minutes is just to show you the state of the art of the epidemic in Italy. First of all, I'd like to outline to share with you the outline. So the first time I will show you the timeline of the early response to the outbreak in Italy and all the measures that the central government, the regional governments adopted during the curve. Then you will see some distribution about the confirmed cases of SARS-CoV-2 infection. And almost all this data, you can find them in our website. Our choice right from the beginning was to be open with data sharing. And so we upload this data every day and twice a week in order to share. At the moment, most of the data are in Italian, but we have also some report in English, and we are looking for, in a few days, reporting also with in English, with English reports. Then focus on some of the Italian regions. Overall, the northern part of Italy is affected at the moment with the high level circulation. A slide on healthcare workers. At the moment, this is one of the critical issue in Italy, and we are going deep in details, and that is a very important issue. And then some idea about the impact of the containment efforts that we are looking. We are just finding some impacts, and we are monitoring them very attentively. Then some consideration about the way we are looking. We are preparing to face this epidemic. So first of all, this is the curve. As you can see, officially we had the first cases in mid of February. Then I showed you the arrows. But then we went back to the cases with tracking the contacts, the symptoms. We came back at the end of January, and at that time we had only so we have 3 periods. The first one was a circulation, and probably we were not detecting that, but we had some 3 cases coming from Wuhan, two Chinese tourists, and then an Italian that was transferred from Wuhan to Italy. Then we had a sort of undetected circulation with some cases, as you can see, that they became openly detected at the mid of February. The critical issue is that these cases were not responding to the case definition that were adopted by WHO at Italian level 2. So having a strict contact with the travelers or coming from China or from other areas with high circulation. And then what is the curve once the first case was detected? The first one is that the measure we adopted in January, in the second part of January, just adopted the national government adopted a measure just to check the temperature for screening at the international airports. Then there was introduced the ban to the flights from direct to from and to China were suspended. Then at the end of January, beginning of February, the last day of January, the government declared a national health emergency, this COVID situation. At that time, we had no cases at the moment. We had just, then we had this, you can see, probably looking at that, you can see these 2 cases where 2 Chinese tourists that were detected while traveling in Italy. They were quickly isolated and treated in our infectious disease reference hospital in Italy, that is Palanzani. But and then this is the other case was an Italian living in Wuhan, and it was once he came back from Wuhan, was in quarantine for 14 days. During this day, he had some very mild symptoms like fever and fever mostly was checked, and it resulted positive to the swabs. The other numbers are reconstructed after we had the first cases. And so the 20th of February, we had the first local transmission detected. It was a very young man. This man had a really active social life. We were able to track almost 400 strict contacts in the previous 14 days, was very active in the community. And fortunately, this man has been dismissed from the hospital yesterday. So after a long period, they had a very, very hard time with it was intensive care unit too. Then after that, just immediately, we started with this case was in Lombardy, and this case was triggered a sort of immediate measures. We went to Lombardy, and we agreed with the regional government to introduce a lockdown of the area where a few cases were detected, and this was very useful at the moment. And another area was in Veneto. You see the map in the next slides. And so at that time, we decided to lock down two areas. The Lombardy areas had almost 40,000 inhabitants. For that it was quite complicated because we had to overcome also some national rules about freedom of people and something like that. Then, since the curve continued, the central government decided to enlarge this measure to a larger area. So two regions were almost involved. So Lombardy and Veneto underwent a sort of red zone. It was not exactly the previous red zone. The first red zone had the ban to move in and out of the zone, so people couldn't move outside, and no one can come in, with exception, of social services or essential service like food, water, and emergency kind of things like that. In this situation, the lockdown was really, but we kept open some activities. That is the issue. Then, since the curve continued and the close region were involved, the government adopted at the beginning of March a sort of national level approach. So it was a strict social distancing measure, including school closure, was also suspension of religious ceremonies, of masses, and kind of sport were almost limited all over Italy, and other kind of measure like that. Then we went looking at the curves. The following step was to lock down, really suspending the movement of people, asking people to stay home. And finally, was a few days ago, further measure that almost impacted also in the production, keeping open just the essential production at industry level, and trying to limit almost all the movement of people outside their own towns. That it was actually, we are in this case. The future is at the moment that the end of this measure officially are by the next week, are planned to the 2nd of April. But of course, this is just an indication. Then we are looking to the curves. According to them, we will decide what to do. The next slide is how is the distribution. As you can see, Lombardy, this is the beginning of the story and was development. And then the other part of the beginning was in Veneto, but at that point, the focal point was really a small town, so 300,000 inhabitants. While the crisis area was Lodi, is a province close to Milan, and this area had almost 40,000 inhabitants, so it was much larger. And then the population of Lombardy is much more, is like 9 million inhabitants versus Veneto, that is 5 million inhabitants. Then this is the area of the Lombardy that was involved. And so immediately almost the EmiliaRomagna, the southern region, was involved. So this area was it is the critical area, as you can see in the next one. Then we have, the rest of Italy is still has circulation, but very local. Most of the circulation is derived from people that quickly moved as soon as they understood that we were preparing a lockdown of this area. They decided to move immediately to south. You have to consider that the Italian social distribution is that These are the richest part of Italy. Most of the industry activities are concentrated in this area, and most of these activities are supported with the workers coming from southern part of Italy. So as soon as you close schools, universities, and activities, people try to come back to their homes, and this was one of the issues that created also some circulation in the other areas. You see also the curve, and that, of course, these are unstable data, but they are updated to the 20th of March. But as I can tell you before, we on daily basis we report an infographic, and twice a week we report the updated. This night you could download our data updated with all the maps, and these are the maps you will find in that. And you see, this is Lombardy, the focal point. This is the area where started the things. This is Milan, just to let you know. This is Bergamo area. That is actually one of the most critically area at the moment. This part is the border with the Veneto region. This part is the border with the EmiliaRomagna. And the Bergamo, as you can see, is the province. This is, you see. And the other one is Brescia, that is very close to the other area that is Lodi, that is the area that is very much important. As you can see, we can see that we have the higher mortalities in this area at the moment, because also the higher numbers of infected are reported, as well as the higher number of people are needing the ICU support. And but you can see the median age of the people is very high, is 65. 65 of the positive cases is 65. This is the regions. The other region is Veneto. That is, the distribution is quite different. We had in this part of the region was the first lockdown small town, and this is Padua. Just to let you know, this is Venice. This is Treviso, and another issue was in Treviso, but was really healthcare associated area, in fact, because some long-term care facilities had a sort of small outbreak, and then they were concentrating in the hospital, and this created some problems on that. The next slide is about Emilia-Romagna. As you can see, Emilia-Romagna is bordering southern part of Lombardy, and this is the area that supported also Lodi area, the initial focus. And hospital like Piacenza and Cremona, Cremona is just up there, but Piacenza and Parma were immediately had to support the close area for giving support for intensive care unit and hospitalization. At the moment, the other issue was, the other focus is in this part that is Rimini, and is bordering with Marche, that is, this is Pesaro, Urbino. And we had the other focus and we tried to control with the strict lockdown measure to avoid the contamination of the rest of the region. For each region, you can find, as we report openly all the data, and the small border are the boroughs of within the province. So this is the region, these are provinces, and this is the boroughs. This is one of the data you can find in our infographic that, as I told you before, is reported on a daily basis. And we had a prevalence of male, median age is 63 years, and we have, of course, a high rate of hospitalization and a high rate of intensive care. We will come back on this consideration in a few minutes. This is the case fatality rate, and so what you see here is that most of the cases are concentrated in the between 80 and 89, and if you put all together, case fatality rate is higher over 80. But of course, we are also people coming from affected and deaths concentrated under 80s. About the people under 49, almost all of them had 1, 2, or 3 comorbidities like cancer, like renal failures, and other issues that were previously affected this kind of patient. Having said that, still of course, the infection was determinant in the fatal exit. What we see in this case is that comorbidities are the most common part, and almost 50% of people had the comorbidities. I think yesterday has been published in JAMA a some short consideration from our group, from our institution about the mortality. And the other thing is that Italy is one of the oldest country in the world, and this area overall, the northern part of the area, there are a lot of people living in long-term care facilities, and there are a lot of people living very long time. So just to tell you the map is easier. Just to give you an example, this area are the oldest area in Liguria, Friuli Venezia Giulia, Veneto, and Lombardy as the oldest regions in the country. Just to tell you, we are around the 23-25% of all population is over 60. In many countries, in many parts, in many cities like Trieste or Genova, you have hundreds and hundreds of people, centennial people. So it's a very old population, and of course there are also many comorbidities. And this is one of the critical issue we have to face with. The other critical issue is healthcare workers, and as you can see, the number are very high. Now at the moment we are trying to understand exactly what's the reason why of that. Probably at the beginning was the thing that people didn't realize that people with pulmonitis or high respiratory tract infections, they didn't suspect it, they were possibly COVID positive, and so they kept them in the emergency area, and they treated them, perhaps not considering as a possibility this diagnosis, and this created at the beginning some misunderstanding, as well as was critical in some part of the country, the approach of people supporting long-term workers supporting long-term care facilities, and that was another issue that is very much important. The other one is the results. The first lockdown that has been done was the Lodi area. This is the area, and you see the results. So after 15 days of lockdown, we had quite good results. So the circulation was limited, and we are able to control or to reduce the number of cases, as well the number of people needing hospital assistance. So we are confident that also the measure adopted all over Italy will be in the high circulation area will be effective, but also we hope in the low circulation areas, so central and south Italy, can prevent the situation that we are living in Lombardy. Okay, and this is, the Aircon RT as was calculated and measured. This is measured at the time. At this time, as was measured in the red zone at the beginning of the situation. Where we want to go, or we try to go, because we are still in the middle of the battle. So what is important is we focus very much of social distancing measures, and we focus also very much in testing of contacts. At the beginning was very, was very extensive overall in the northern part of Italy, trying to track all the contacts in the previous 2 weeks, and trying to put in quarantine all these people. Then, with the increasing of the new cases, this kind of thing it became overall in the high circulation area very much a quite impossible things. So we moved to the definition of tracking the strict contacts in the previous 2 days, 48 hours. And still now the focus very much is on tracking and monitoring strict contacts and positive at home. This is the challenge we have at the moment. The other thing is that we had to change really completely the organization of our hospital system. So we are almost less than 1 month, we were able to more than doubling the number of beds in intensive care units. And still, this is a challenge. And this is not easy because, as you can imagine, there is a shortage of machinery, of protective gloves, protective masks, and so on. And that is another very much important challenge. And the other thing is to train healthcare workers and all people supporting healthcare at the best, making them really. One thing is making them available of the tools they need. The other thing is to make them aware of the risk. Not at the moment where there is high circulation, because of course they are aware, but where the circulation at the beginning was not so evident, so that there was some misunderstanding at the beginning. This is the response of our institution. You can go to the website, you can find it. Unfortunately, they are in Italian, so sorry about that. We are trying, if some of you need some more detail, we can, of course, provide you with at least a short translation. But the central part is the website, and each arrow is a link. You can go deeper. So we are a technical scientific committee. We are microbiological surveillance. We are modeling and epidemiological surveillance. We are providing advice to healthcare professionals how to manage the risk. We are just training people, distance learning. In less than 10 days, we set up a training course of 16 hours and as a learning distance, and we were able to train more than 100,000 according to National Health System workers. But then we also distributed this training system to university, overall for medical school, nursing school, and professional schools. And we're also able to share this learning distance with other people like Red Cross and supporting aids like emergency ambulance teams and so on. We, of course, have a team on preparedness, so we are also looking at what to do the next. So how to, it's not just to prepare, it's just to mitigate if you want, or to be ready to develop the system. We have also an ethical committee, since at the moment there are many issues coming from research, coming from how to deal with the cases or to manage cases. Then a very critical issue overall for people living at home as in a quarantine is the waste management. And these are example of poster we prepare for them. And something about the veterinary issue, because sometimes some news about the role of animals or pet animals were published, and as soon as they were published, if in the few minutes or hours that we were able to counter-inform people, we had people, dogs and cats left in the streets, and because of the pain of the panic of the people. Then we are trying to work and to keep in contact with our colleagues from all over the world, and this is an example. We are very happy to share with you this experience. A very critical issue is to keep the communication and the information. This is, pills. This is a short guide, pills against the panic, or these are, 10 rules to adopt every day. And this is another document, the pills of the epidemic. So few words to understand what is an epidemic, which is a cure, what is a case, what is a suspected case, what is the meaning of the words that usually also in the press or in the media are used, and that people usually don't know exactly the meaning of that. So what is pandemic, what is epidemic, what is outbreak, with the low level circulation or high intensity circulation, and so on. And the other one is that we have 18 teams working on many aspects of the issue, because we have to work on reconvert part of our industry to prepare masks. At the moment there is a shortage, I think, all over the world, but still in Italy is a problem. To prepare disinfectants in a huge quantity, or also alcohol based solution for hand washing. And I just give you some few examples. But there are other issues like, environmental decontamination, yes or not, and we are also every day tens of questions proposed by local levels, by regional levels, asking us for having scientific advice on that. Finally, what we learn about that. So the first thing is to learn is, how to say, you have to be prepared before the high number of cases comes, because when it comes, it's very critical to manage. It's a sort of tsunami at the moment, and you have to, if you are not prepared, it's very, very much difficult to face with it. We were very in this difficult times, but we were, let's say, lucky in some way, because Lombardy was the first region, and the plans for preparedness were just assembled with them, and so they were able almost immediately to adopt the measure we planned in theory. But at the moment, overnight, we moved from theory to reality. And the other thing is focus on fragile settings. This is a very much important thing. Long-term care facilities in countries like us, with the very high percentages of elderly and fragile elderly, are very, very much fragile. And if an infection one case is enter this setting, is very, very much difficult to control the infection. That is a very thing. Another one is to keep the home quarantine. Our policy is to guarantee home quarantine, but still, where this is not possible, the civil protection that is under the head of cabinets in our governments, they are just using hotels or other buildings where to put this kind of people. Another very critical issue is infection prevention and control, and actually is one of the higher efforts we're trying to do, trying to guarantee to all people the right training, the right tools to focus. And in this time, overall, in the crisis time like this, the procurement of all the needed tools is another very critical issue. And at the moment, it's a critical issue also the testing material, because reagents or other kinds of things like that are sometimes you have difficult to find them in the market. And as soon as the number of countries moving rapidly with infection, the numbers probably will be a critical issue all over the world. And the other thing is we are moving now how to manage once the peak will overcome, and how to manage the descending part of the curve. And since it's not easy at the moment, you have not really many tools, because of course there are a lot of clinical trials ongoing, but they are still ongoing. You have not a vaccine to really. There are many researchers all over the world. They are looking for a vaccine, but at the moment we have not a vaccine. It will be not available in a few weeks, or not at the time useful for the moment for us. And the other thing is to try to manage to keep different areas with different levels of circulation separated, so that you can reduce the transmission of infection in different areas. What you see is another set of indication, like to see indication ad interim for prevention of control in long-term care facilities. This is how to keep isolation at home, how to keep to protect yourself as healthcare workers if you are working in the primary care levels at territory level. The last consideration, and then I stop my presentation and I'll be happy to answer to your questions, is that you have to consider that Italy has a national health system, so all the activities are provided for free by the national level, the national system, but the organizational level is at the regional level. So regions are responsible for running the healthcare system. The central government is responsible for overseeing and addressing all the issues in Italy, but still the application of the activities at regional level. This is another very important issue for countries like us, because the mediation and the continuous dialogue with the serialities are very much important. Thank you very much.
Thank you so much. That was incredibly informative and thorough. Everyone, the presentation and the data from which that presentation was built is on the Institute's website, iss.it.
Yes.
And it's updated. Very frequently, if not daily, probably.
No, the infographic is daily.
Daily.
And the more detailed report about deaths, about epidemiology in the countries, in the regions, is twice a week. So usually this evening you will find the last one, and next Friday, Tuesday and Friday evening, okay, we upload these documents in the website.
Okay, thank you. And so this presentation is being recorded, but also in the future you can find the updated information, yes, on the website. I wanted to ask you a couple of questions myself before we opened up to the wider group. You mentioned the shortage of PPE and testing as well. If you could talk about some of the efforts to overcome those shortages, what has been successful? For example, have there been private-public partnerships to try to address some of those things? So just if you could talk about some of the efforts to bridge the supply shortages.
Yeah. So speaking about the diagnostic test, is at the moment, as you can know, you know very well, the most reliable tests are those tests looking for RNA, and they are quite time-consuming, and they need a good expertise to be reliable. And this is very much important because you have not a large availability of this test. So you have to decide which kind of people you want to test, first of all, because you are not able to cover all the people you wanted. So this is a very much important. We decided, according to WHO guidelines, to focus on symptomatic people and early symptomatic or mild symptomatic. And this is the end to track people from very strict contacts if they are symptomatic or mild symptomatic. This is the first. Then a different issue is about healthcare workers. Also, those exposed are tested. As soon as we'll have other tests available, serological tests. At the moment, we have not kits or not products that are still reliable. There are too many false negative, and this is is not good enough for using them at the national level. They are under research at the moment and validation. Different issue is about protective individual tools like gloves, masks, and other goggles and kind of thing like that. This is one of the critical issue because production at the moment was concentrated in a few parts of the world, and then immediately, as soon as you have a great number of new cases and your hospital go into an overflow, is very much difficult to keep to all the quantity. So we had at the beginning, we tried to find them all over the world. It was quite difficult. And so, but the other thing is running at the moment is a sort of governmental incentive to other industries, or local industries, to reconvert their activities to produce this kind of mask or other issue that can be supported. This is very much important because you need a huge number of them, and overall, considering that is not a curve going to be to end in few days, but we'll continue for weeks, and then even when we hope to come to a cure with the R0 under 1, we expect that we have to keep our attention to. We will have some cases too, and that is very much important to have enough of this tool for protecting healthcare workers. The most important measure is to reconvert at the moment our part of our industry on voluntary basis. There are some incentives, of course, and to validate the production.
Okay. So a quick note. Your website apparently does not load easily on all browsers because of a security setting. But it's for everyone who's on the call. The website iss.it is working. It's just it doesn't have the secure socket layer. So some browsers may try to block it, but I'm looking at it right now in my browser and it is working. A question, so the audience that you have on the call is unique. They are it's a global public health call. Can you talk about the role that that National Public Health Institutes in particular you have played in, your institute has played in Italy, and also you're talking to a group of people who are maybe several days or maybe several weeks behind Italy on the outbreak curve. What advice do you have for people in National Public Health Institutes and what role they can play?
Well, first of all, I have to say that in our situation at the moment, the government was very much attentive. It has been, and it is very much attentive to scientific and technical advice. So we have a technical and scientific committee where we have our institute is part of it, and together with other personnel, scientists and other institutions. But still, our National Institute has a key role within this scientific and technical committee. So most of the decisions adopted by the government were previously supported that opinions of that recommendation from this scientific and technical committee. This is, I think, a good news, because it is not easy sometimes the dialogue between scientist, the public health officer, and decision maker. Okay. In our case, this happened, and this is a very much important thing. So, having said that, what we see in my experience is that probably national health depends of the characteristic of the institution. I'll just give you an example. In our institution, we have together, missions like from the United States, you can have in NIH, in CDC. So we have different. So we are regulatory. We are basic researchers. We are a regulatory authority. We are authorizing production of masks together with epidemiological survey. So we put together many different issues. So it's quite a unique experience putting together. In other countries, you can have these pieces of public health split in different institutions. In our case, it was easier in some way, but still the problem is that once the curve starts, the number of issues you have to face with is huge. You have to work about how to disinfect surfaces, environments. We have to manage about question about animals, about food. They are asking to, beside the epidemiological and microbiological survey and the surveillance, that is of course one part. Beside the fact that you are just training healthcare workers, and you are just focused on long-term facilities, infection prevention and control, but still other issues like environmental issue, about chemical issue, new disinfectants proposal. When you ask about reconverting industry, you have a huge number of issues that are emerging, because in few days you have to do something that usually needs weeks or months. So the challenge is to be ready, and this is the reason why I showed that the picture of the with the splashes. Looking, because there are all the issues we are asked immediately to answer. So my advice is to be prepared. You have to be prepared. You have to be ready. You have to be ready to answer. Overall, if the decision maker asks you advice for them. The other instance is if you have a sort of regional devolution, like in Italy or United States, like with the states. Issue from different states or different regions are very different, and so another very important issue is to standardize the rules and to try to keep a common line all over the nation.
Okay, that's very helpful. So I'm going to go to the questions in the chat. I'm going to start with can you evaluate are you able to evaluate the impact of the distant training of healthcare workers, and did it positively impact the infection rate among the healthcare workers?
Oh, we had evaluation because the courses were courses officially recognized by national systems, so they have credits. But by law in Italy, each healthcare worker has to collect 15 credits per year, and this course was able to provide 16 credits. So to get the credit, you have to overcome evaluation, but still is a questionnaire. So it's not really. It's too early to understand that, because the figures we are focusing on the healthcare worker with specific surveys, both in hospital, in primary care level, and long-term care facilities, trying to understand better what are the most important issue in transmission. And so we are not able at the moment to do that. We plan to do that, but we are not able to. We are not data ready at the moment.
Okay. What measures did you take to create additional human resource capacity to perform contact tracing and testing?
Well, I have to spend a few words to describe how we are organized at the local level. So look, we have the country is divided at regional level, and within regional level you have local health trust, that including hospitals and including primary care and department of prevention, or public health department, as you want to call them. What happened is that the first line was a department, public health department, and that is constituted by many people, professional working both of infectious disease prevention, but also food safety, other issue, and environmental issue. And almost all the public health department, when started the cure, in few days had to reconvert of the people in contact tracing, and they were supervised infection control people, but all other technicians, doctors, nurses were moved to focus on contact tracing. So the first thing is all these resources that are quite consistent in our system were reconverted to contact tracing and to control these kind of things. The second one is about primary care. Primary care overall general practitioner. As you know, we have a system, each citizen has a general practitioner for free. Usually there is one general practitioner every general practitioner has 1,200 to 1,500 citizens they have to follow, to take care of. And so these people was at the first line too, because every people coming from flu-like symptoms, and they were quite exposed right at the beginning, because they were not completely immediately evident that this kind of people could have COVID, and this is another risk area that we have to face with. In these cases, also most of the activities in primary care are reconverted to support people mild positive or with mild symptoms at home, and this is another issue. Then at hospital level, you have to reconvert almost all the hospital. At the beginning, we started with creating COVID hospital. So in the regional network hospital, there were some hospital identified and planned to concentrate all the COVID people. Then overall in Lombardy, this was not enough. So almost all hospital. So the other thing, very important thing, is to stop the other hospital activity, overall the elective one, because overall if there is mobility among regions, is very, very dangerous. So we stopped all the elective activity, and of course emergency is kept. But the reconversion is very much important, and while you reconvert these people, you have to train them at least. So Lombardy, for instance, has, before reconverting that people, one day 8-hour training course just to explain to all these healthcare workers the basics, let's say, to afford this kind of thing. Another very critical issue is we created, besides the intensive care unit, the semi-intensive care for respiratory support. That is another issue very much important.
Okay, so were you as part of your and your peers' communication strategy throughout this crisis, were you able to, or have you been able to collect public opinion data or psychological or sociological data that has informed the communication strategy over time?
Well, we have an information office and a press office. This is done by the Ministry of Health overall, because then the decision maker and then the official, rules are set up by the Ministry of Health. No, we provide advice. So the leader of the communication, the Ministry of Health, we are just supporting them as scientific. So they are doing that, and I think one issue, very important issue, will be that is raising, and that we are exploring also some way, is the impact of this measure of the mental health, of the psychological well-being. Of course, people locked down at home is for 1 day is okay, for 2 days okay, but when you stay at home for 15 days, it's another issue.
Yeah. So on that subject, on your last slide, when you were talking about lessons learned and challenges ahead, you talked about family transmission within the household.
Yeah.
Can you talk a little bit more about the efforts to minimize that, to keep people safe when they are as safe as possible when their own family members are infected?
Well, at the beginning, we started with the idea of keeping that people at home and providing them with advices how to avoid to contaminate or to spread the infection to the other members. Now, with this practitioner and primary care nurses were able to support them by telephone, by monitoring them, by asking them, and so on. Now we are moving to say that if you are living in a family, if you are positive or you are suspected case, and you stay in a family, all the family should be in quarantine, because it's very much difficult to keep the distances. And if you are small numbers, you can manage it. If you are large numbers, it's very much difficult. On the other side, there are some cases where it's very difficult to keep also, because number of people living in a small number of square meters. So the idea, right from the beginning, we decided to have some hotels or some other residents that are dedicated for positive or mild cases. This is an issue, very difficult issue, because you have to face with the freedom of the people. So of course, this is an issue that in Italy is present, and so you have to convince, or you have to motivate. It's not immediately that you take the people and put them there. So you have to manage all this aspect of the freedom of each one.
Okay. So in the last few minutes, I'm going to allow participants on the call to speak themselves if they want to ask you some questions directly. And the questions that are in the chat, I'm going to copy those down and I'll email those to you in case you're able to address them directly. But go ahead, people on the call. If somebody wants to jump in, if you can turn on your video and unmute yourself, you can go ahead and ask a question directly.
Hello, can I ask a question? This is Farhan Tazib from UK.
Yes, please.
Thank you very much. Many thanks and congratulations to our colleagues in Italy. Last night, our Prime Minister in the UK gave a speech, and from a scientific point of view, our modeling is that we are 2 or 3 weeks behind Italy, and we are mirroring the same issues. So I'm just wondering, from a public health advocacy side, if there is anything which we should do in the UK in the light of your learning. Secondly, we're currently developing some ethical and legal guidelines. I'm just wondering whether in Italy you have developed any specific ethical guidelines to support your decision making around COVID. And thank you very much once again.
Well, thank you for the question. The first question is, I tried to be very synthetic. I think the most important thing is just to invest in training. If the curve is starting, probably you cannot stop it, or you can just move a little bit, but you cannot stop it. The most important thing is to make aware both people and the healthcare professionals about the risks. This is, I think, a very critical issue. I have to keep it. About the ethical issue, now they are raising them. Overall, for anesthesiologists, overall, there are issues discussing about prioritizing. It's not really fixed, it's just part of the debate. some scientific society raised the issue of prioritizing those to put in intensive care unit, looking also at the age of the people that support their respiratory system. Actually, the most organized aspect for ethics is about clinical trials, and that is another issue. You know, once you start with that, you have a huge number of people proposing all sorts of research, and keep this proposal within a scientific and rigorous track is very much important, because you know you have an overload of proposals. Mm-hmm. I just can tell you these few things.
Thank you. Are there other questions? You can unmute yourself and ask a question. We've got about 5 minutes left.
Sorry, may I ask?
Yes, please.
Sorry. I just asked in the previous one of the message talking about the future and quarantine, which is announced in many countries, including in Ukraine, where I'm from. Talking about the duration of quarantine, is it within the period when the last case is registered, plus incubation period, which is counting now 14 days, as I understand?
Yes, the duration of quarantine for us is 14 days for those that are suspected cases or strict cases or strict contacts. But for those positive or those with symptoms, we define that you need to have the end of the symptoms and the fever, and you have to do 2 swabs within 24 hours, and they should be negatives. Only when you have this situation, you can just come back, close your account. If you are just a strict contact, it's 14 days.
Thank you. Thank you.
May I have a question?
Please.
Yes, this is Francesco from the Venice office, WHO. Hi, Silvio. Thank you so much for this very interesting and extremely important sharing of information. And I was just wondering, is it something that you plan to do on a regular basis? Sorry that maybe this is something that you said at the beginning, because I think that sharing this information with as many countries and also the subnational level as possible, it's so much important, and I get very many requests on this. Or if you are available also for other networks to share this experience, which was outstanding. Thank you.
Thank you very much, Francesco. Our policy, I told right from the beginning, is to be completely open with data. The fact that we upload the data every day and twice a week is clearly an evidence. At the moment, unfortunately, we were not able to publish too much because, you know, our priority at the moment is to try to answer and to get the information ready for supporting decision-making and controlling the epidemic. So this is our fault, of course. But having said that, right from the beginning, we had many activities within countries. So, for instance, I didn't mention it, but just to give you an example that is very much useful. Starting from beginning of February, I think, we have the 5th or the 6th week. This is the 6th week. Every Wednesday, we had 2 hours conference with more than 100 hospital and Department of Health and the public health department, local public health department connected, when we, in 2 hours, share information, share discussion, transmit recommendation, try to get suggestion to improve the quality. So it's a collective issue, and we engage both scientific societies, colleges of surgeons, colleges of doctors, college of nurses, universities, all kind of stakeholders can be involved on that. So they are available. We have the slides. We are presenting every kind of things. For instance, tomorrow this conference, I'm just looking to the agenda I just approved, is about how to how to collect the swabs, how to transfer correctly the swabs to the labs, how to fashion mask, how to support with the psychology the general population. So there are topics with specialists trying to in 20 minutes to give some some hints to the professional, to the scientists. The other thing about the international, we had many bilateral meetings, but also this example is we are very open to share with all those interested in our data. Our policy is to share data, to share experience, to give access, to show the positive things, what we learn. Also, what we learned was not going at the best, so that other countries or other colleagues can avoid to do some errors that can. We don't, at the moment, we have not a list of errors, but of course, I suppose we did some of them. And I hope not too many, but we are measuring the impact of the measure, and as soon as they are available, we will share for sure.
Thank you so much. We will be back then to you. Thank you.
Thank you. We are at time, Professor. Thank you so much for your time. For everybody who's on the call, we're going to make the presentations on this call, including a video of the call, available, and we'll follow up by email. If you received the email directly from us about this meeting, then we have your email address already. If you receive this email, if you receive the notification of this call as a forward from somebody else, just leave your email address and your name in the chat, and we'll make sure that you receive the follow-up as well, because we won't, if you got this from a forward, we don't necessarily have your contact information directly. So thank you for that. Thank you very much, and I wish you very grateful for your time and your thoughts, and wish you all the best, and your colleagues all the best, Professor. Thank you.
Thank you very much to all of you. Just one last recommendation. A very much important thing is to convince people that there is a real danger. Sometimes they don't believe immediately. I think common people. So to convince people, look, this is a real danger for public health, for your health, overall for the health of the frail part of our society.
Okay. Wonderful.
So,
thank you very much. Thank you.
Bye-bye.
Bye.
Bye.